Hi, I'm Dr. Tom Salmon. Today we're going to be talking about the anti-inflammatory diet. Acute inflammation is a natural body response to injury, overuse, or the onset of an acute disease. Chronic inflammation, that chronic inflammatory state is associated with most degenerative diseases, such as heart disease, cancer, arthritis, diabetes. The chronic inflammatory state can actually be minimized or eliminated by a change in diet. The foods that we eat contain fatty acids. The omega-3 fatty acids are the anti-inflammatory fatty acids, and the omega-6 are pro-inflammatory. The standard American diet, which has the letters SAD to it, S-A-D, is actually more in line with 15-to-1 ratio of pro-inflammatory fatty acids to anti-inflammatory, so that it leaves the average American in a chronically inflamed state and prone to chronic degenerative disease. By reversing our fatty acid ratios, we can actually promote health and eliminate inflammation and prevent chronic degenerative disease. By that, we would want to change that 15-to-1 ratio of pro-inflammatory to anti-inflammatory to a 1-to-1 ratio, and we can actually keep our bodies healthy. So now I'd like to talk about the particulars. First, I would like to talk about the anti-inflammatory foods, or the good. They are fruits, vegetables, and potatoes. These are mostly anti-inflammatory. Fish, especially deep cold water fish, have omega-3 or the anti-inflammatory fatty acids. Be careful though, fish that would naturally be cold water fish raised in farm situations are oftentimes fed foods that are pro-inflammatory, which renders them actually omega-6 or pro-inflammatory as opposed to being anti-inflammatory as they would be in their natural habitat. Olive oil is definitely anti-inflammatory, and when consuming olive oil, the greener it is, actually the more anti-inflammatory it is. And you want your olive oil to be first cold pressed and not chemically pressed. Other oils are generally considered to be pro-inflammatory. Soybean, canola, and corn oil are pro-inflammatory and not good for you. The pro-inflammatory foods, which we call the bad, which are the ones with the omega-6 fatty acids, those would be, first of all, we talk about grains. They're very pro-inflammatory. Especially wheat and corn, they're the more inflammatory. Brown rice, yes, even brown rice is pro-inflammatory, but much less so. Dairy is by far pro-inflammatory. Meat in general that you would buy in supermarkets here in the States is generally pro-inflammatory. The only time meats are not pro-inflammatory is when they're been wild grass-fed animals. Then the mussels have omega-3 fatty acids, which are anti-inflammatory. But it's important that they are grass-fed. And if you wanted to buy these things, there is a place called eatwild.com, and they have these. The fourth thing is sugar is very pro-inflammatory, and the same, of course, goes for salt. Eggs are pro-inflammatory also, but Eggland's omega-3 eggs are actually anti-inflammatory, and they're not a problem at all. Nuts in general are pro-inflammatory, but walnuts, almonds, and cashews are much less so, so you're getting more to the center with that. Eating dark chocolate is actually anti-inflammatory, and a lot of people will be going, yay, when they hear that. Milk chocolate, though, is pro-inflammatory, and which should be avoided. The concept is that we want to understand that with each meal that we're consuming, we're either inflaming or deflaming our body. And so that the idea is that we want to be deflaming whenever we can. So that way we're avoiding this inflammatory state. Now, some of the conditions that are influenced by this chronic inflammatory state, which actually show improvement when we eat an anti-inflammatory diet, would be allergies and arthritis. And arthritis, not only osteoarthritis, but rheumatoid and gout show improvement with this. Asthma, blood pressure problems can show improvement. Depression definitely shows improvement. And in fact, most people don't understand that wheat is implicated in almost all cases of depression. Colitis is by far improved with this. Chronic fatigue, diabetes, eczema, psoriasis, lupus, MS. Actually, PMS is greatly improved by this. Obesity is greatly improved. Prostatitis, psoriasis, chronic yeast infections, all these types of things are really improved by going on the anti-inflammatory diet. And just a word, an aside, is that in the office I put quite a few people on this diet, and it's not uncommon for people to lose 40 pounds in 6 months' time just by changing this inflammation that's going on in the body. The diet actually works well for people that are on NSAIDs, these non-steroidal anti-inflammatory drugs, or these COX-2 inhibitors. Now, these drugs do bring down inflammation, but they have a lot of toxic side effects. And of course, you'll see that in the papers all the time. The anti-inflammatory diet will do what these things can do. And the other thing I want to talk about is that the anti-inflammatory diet actually has anti-aging implications. So it's really a good thing to do. Now, what would be a reasonable time frame for improvement? Well, I have patients say that they've had improvement, they say, oh, geez, 2 weeks, and I'm starting to feel better. The most reasonable time frame to see a dramatic change would be 6 to 8 weeks. While that does seem like a long time, most people will report, in 2 to 4 weeks seeing some percent of change. Now, I've been in private practice for 30 years, and I've had some wear and tear in my hands as a result, and I had developed some osteoarthritis in the base of my thumbs. And I saw changes begin in 2 to 3 weeks. I use this diet extensively and a big proponent of it. If you have any questions regarding that, feel free to call me.